The 3-day average of ICU admissions and also intubations due to Corona-19 are down in New York, and some are giving at least partial credit to a new approach treating this disease. And CBS 2's Tony Aiello tells us about it.
In the early days of the pandemic, experts predicted a dire need for a critical piece of medical hardware.
Ventilators. What ventilators do you have?
To do with 400 ventilators.
But more than a month in, with many patients on ventilators not surviving, some frontline doctors are reconsidering.
It has challenged every dogma that we believed.
Dr. David Farsi is president of the American Academy of Emergency Medicine and an advocate for an approach he says has dramatically reduced the number of his patients on ventilators.
I think people are becoming believers.
Doctors noticed many COVID patients with hypoxemia, low blood oxygen levels. 95 to 100 is normal.
And if you go down to the 80s, forget about that. I mean, 6 weeks ago, everybody would be running around like getting ready to intubate you and put you on a machine.
Our ventilators are not able to give enough oxygen.
Brooklyn Dr. Cameron Kyle Seidel was among those who started questioning using the established ARDS protocol to treat patients, with many put on ventilators and not surviving. A number of frontline doctors adopted a protocol to deliver high-flow oxygen through a tube or mask for long periods of time, and using so-called proning, moving patients off their backs.
And suddenly their oxygenation improved. And we're able to reverse the hypoxemia and prevent the intubation.
It doesn't work for all, and this approach has critics uncomfortable with a protocol that hasn't undergone a lengthy clinical trial.
We don't have the time to do that right now. This is a war zone.
CBS 2's medical expert, Dr. Max Gomez.
You have always been a show me the data, show me the research kind of guy.
This is not usually what I would say, but I have come to believe that it's not unreasonable to try other things.
Whatever is driving this curve down, it's welcome news. Tony Aiello, CBS 2 News.